It is post-op day 5. So one, I think I said this before, but a gown like this, so this was gifted to my sister who's also going through this journey, and I'll talk a little bit more about her. I was actually thinking about filming her journey as well, and then her and I kind of sitting and talking on film, if she'll agree, about our experiences, differences, that kind of thing. So her journey is a little bit different from mine. So she is doing a 3-step journey. So she's doing she did a mastectomy, a breast lift, because she's doing nipple sparing mastectomy. So she did her mastectomy first, and then when I'm done, she will then do the mastectomy and the mastectomy with the expanders, and then implant replacement. Anyway, one of her coworkers, I think, gifted her this and another top because she went through a similar journey. And this, like, this is a game changer. This is like a very old grandma robe, which I love. It is super soft. But the most important thing is it buttons here, right? But it has pockets for drains, and like for multiple drains, which is really awesome on both sides. So if you're someone who ends up with 3-4 drains, you have pockets for all of them, and it's on the inside. So I have absolutely worn this out of the house. The other top is a gray like zip up top that looks more like kind of like a workout jacket, which is nice. Also has pockets for drains. I wanted to kind of tell y'all, it's been, I think, post-op day 2, I took 1 dose, post-op day 1, I took 1 dose of the narcotic, and I haven't taken a narcotic since then. And then post-op day 3, I took 1 dose of Tylenol, and I didn't eat anything after that. And yesterday, I took 1 dose of Tylenol first thing in the morning, so when I get up and I kind of sit up, I tend to have pain or discomfort kind of right in the center of my chest. So I took Tylenol for that when I first got up. Didn't eat anything the rest of the day. I'm taking antibiotics, and because I didn't take anything throughout the day, I almost forgot to take my antibiotics. But I woke up this morning and I don't have any significant pain. I'm uncomfortable. My chest definitely feels tight, and some of that has to do with the bra, some of that has to do with, like, there's a bunch of gauze in here, so I'm not this big. There's a bunch of gauze in here, but I wonder if some of that has to do with the pressure from that. But generally speaking, I don't have a lot of discomfort, which is awesome. So I'm not gonna take anything today. I cannot imagine doing this without the block that I got, because I think that's probably made the biggest difference, because I can still tell that the skin, like here, is still numb. It's still numb. And so I think that has made the biggest difference for me in terms of pain. The other thing that I noticed this morning, which I don't even know how to feel about, is up here, and you can probably see it, is there's like a little ridge, and I'm assuming this is where the expander is. It is not flat. It is a nice, I guess you could say a ridge. I know, or I've heard or seen, where one of the people's biggest worries is about having the expander too high and the implants or your boobs look too high and it not look supernatural. So I'm hoping that just with the reduction in swelling and filling up the expander lower, it'll drop that. That's my assumption. I actually have no idea if that's in fact what it is. Again, my first appointment is on Tuesday, post-op day 7. It's a nurse check. I imagine she'll take the gauze out, but there's no bleeding or anything on the gauze, but take the gauze out. I don't know if she'll take the bandages off or not. If she does, then I will take pictures of that, or have my sister help me take pictures of that. And then my first post-op appointment with the surgeon is a week from Wednesday. So not this coming Wednesday, post-op day 8. It's going to be post-op day 14. So it'll be 2 weeks from surgery. Yeah, please forgive my hair. So as you can see, I'm keeping my hands really low. I'm not supposed to take my hands above my head, just to have T-Rex arms, and I can say that I've not been the absolute best about that. You guys know I have 2 toddlers, but I'll tell you about that in a bit. Bye.